Why visceral obesity is the most dangerous form of obesity?
Now, we have quite a bit of evidence from large imaging studies that have been conducted all over the world, computed tomography or magnetic resonance imaging, that individuals, irrespective of their body weight, their body mass index, that have an excess of fat in their abdominal cavity, they are characterized by a whole constellation of abnormalities. They are insulin resistance, they have a pro-inflammatory profile, they have an atherogenic dyslipidemia. And that constellation of metabolic abnormalities substantially increase their risk of various cardiovascular complications as well as type 2 diabetes. And studies that have actually examined this tissue obtained from surgeons have shown that it has a very peculiar metabolism. Those large cells from the visceral, expanded visceral adipose tissue, they have a very lively lipolysis. They produce also inflammatory cytokine that expanded the tissue that contribute to create, again, this very inflammatory insulin resistance atherogenic milieu. And we also know that this expanded visceral adipose tissue might probably be the consequence of the relative inability of subcutaneous adipose tissue, the fat that we have under the skin, to properly expand. You know, in North America and in Europe, all over the world now, we have a toxic lifestyle. We are sedentary, so a lot of us are in positive energy balance. What those studies have shown is that if you can expand the subcutaneous adipose tissue, then you create a sort of a metabolic sink, which will protect your heart, protect your liver, all the normally lean organ. But in visceral obesity, it's not the case. If you're viscerally obese, you have dysfunctional subcutaneous adipose tissue, you'll have a fatty heart, fatty liver, fatty skeletal muscle, and obviously this whole, I would say, profile is extremely toxic to human physiology.
And could behaviors be considered to predict cardiovascular risk?
Now, we have a lot of evidence that have shown for 40 years of cardiovascular epidemiology now that well-established biological risk factors such as cholesterol, blood pressure, diabetes are predictive of increased risk of cardiovascular disease. But now we have very robust evidence that behaviors are also important. So lack of physical activity is now a powerful risk factor for cardiovascular outcome. And unfortunately, there's more death related to inactivity, physical inactivity, than smoking worldwide. So it's a major, major modifiable risk factor. The other thing also is that we recognize is that nutritional quality, which can be measured now with simple food-based tool, is also predictive of relevant in the assessment of risk of cardiovascular disease. Unfortunately, tools to measure overall food-based nutritional quality and physical activity are not used in clinical practice. And this is really one of the goals of my laboratory right now, to develop very simple practical tools to measure, to identify the individuals who are abdominally obese with too much visceral fat. And we have proposed to use waist circumference on top of the body mass index as a very simple metric to identify those who would have too much fat from the inside. Same thing, we have proposed also very simple tool to measure cardiorespiratory fitness, how fit you are, because this is a powerful risk factor beyond the traditional biological risk factors. And same thing, we have worked with colleagues around the world on tools to measure overall nutritional quality and level of physical activity. And we found that those, we call them 4 lifestyle vital signs, are very useful beyond the biological risk factor to predict the risk of cardiovascular disease. The problem is that right now in clinical practice, we are not using those lifestyle vital signs, and this will be the objective of the activities of our lab, to promote the use of those lifestyle vital signs and to show the added value of using them in clinical practice.